And thanks for the opportunity to make this presentation to all the participants today. And Matt made my work much easier by discussing the objectives. So I'm going to get straight into the presentation. During this presentation, I will be using the term cannabis instead of marijuana, which is the more appropriate terminology. Prior to 1910, marijuana didn't exist as a word in North American culture. Rather, cannabis was used most often in reference to medicines and remedies for common ailments. Supporters of Pancho Villa first used the name marijuana in 1895 in Sonora, Mexico. That was just my disclaimer in here because you will notice cannabis as part of the presentation here. So what is cannabis? Cannabis is a common subspecies of industrial hemp, or simply the hemp, which is commonly known for fiber production and hemp seed oil. It grows wild in many of the tropical and temperate areas of the world. Cannabis contains numerous chemical compounds. The main active constituents of cannabis are known as cannabinoids, which we will discuss in the next slide, with THC and CBD being the most studied cannabinoids. THC is the only cannabinoid with psychoactive effect and derives flowers of the female plant and what is generally known as bud, which has trichomes enriched with cannabinoids, are generally used for medicinal purposes. Cannabinoids are a class of diverse chemical compounds that act on cannabinoid receptors on cells that repress neurotransmitter release in the different areas of our body, particularly the brain. These compounds include the endocannabinoids, which are produced naturally in the body by humans and animals, the phytocannabinoids found in cannabis, and synthetic cannabinoids, which are manufactured chemically. The most notable cannabinoids, as mentioned in prior slides, are delta-9 tetrahydrocannabinol, or THC, and cannabidiol, or CBD. There are at least 85 different cannabinoids that have been isolated from cannabis with different characteristics and effects. Synthetic cannabinoids are laboratory synthesized molecules, or they are extracted compounds that bind to cannabinoid receptors. Two examples of these synthetic cannabinoids or extracts that are available by prescription in Canada are nabilon and nabiximol. Nabilon or Sisamet is available as a capsule, and nabiximol is an oral mucosal spray. Nabilon is indicated for chemotherapy-induced nausea and vomiting, and nabiximol is approved for multiple sclerosis-associated neuropathic pain, spasticity, and advanced cancer pain. The Marijuana for Medical Purpose Regulations, or MMPR, were announced and introduced in 2013. It was intended to address public health and safety concerns that existed under the Marijuana Medical Access Program. MMPR is intended to provide access to quality-controlled cannabis produced by licensed producers for medical purposes to Canadians who need it, while giving program participants more choices of strains and suppliers. It includes comprehensive production, licensing, personal and physical security, and inspection regulations. It was also intended to prevent diversion, improve record keeping, and simplify and expedite access to medical cannabis. What are the main differences between MMAR and MMPR? MMPR replaced MMAR regulation. only physicians were allowed to authorize or prescribe cannabis under MMAR regulations. By introduction of MMPR, physicians or nurse practitioners in jurisdictions that they are allowed to prescribe are allowed to prescribe medical cannabis. There is no particular licensing or authorization required for these physicians or nurse practitioners to prescribe medical cannabis. There was a complex process of application in MMAR program. By introduction of MMPR, there is a simple registration with licensed producer, and there is no delays and lengthy process of applications to Health Canada. There were 3 different options of production available under MMAR program. One was to purchase directly from Health Canada supplier. Second one was to produce personally the product. And the third option was designated person to produce medical cannabis for the patient. According to MMPR, only licensed producers are legally authorized to produce and distribute medical cannabis to the patients that have an authorization of what it is called a medical document signed and authorized by a healthcare provider. Under MMAR, Health Canada mandate was to authorize and license individuals and administer production. Under MMPR, Health Canada mandate is more regulatory process to regulate and license producers, as well as audit and inspect licensed producers to ensure compliance with all the standards of practice and good production practices. The distribution under MMPR is directly from the licensed producer through secure delivery to the patient.
Kaivan, can I just butt in here for a second? I'm not sure, are you switching the slides or is it still in the presentation objectives on your end?
No, I have switched them.
Oh, that's odd. It's not switching on my screen.
Okay.
Give me 1 second. Let me just ask the audience, is anybody else seeing the presentation objectives slide right now? You can just type in the questions, or are you seeing the current slide?
We're still seeing the same one.
Okay, so it seems like everybody's seeing the presentation objectives slide still for some reason. I'm not sure why. Let me just switch over this here. I may have to take over this if it's not going to work, Kaivan.
Okay.
So just give me 1 second here. Sorry about this, everyone. Switching things over. Okay.
I'm on slide number 7, actually.
Gotcha. Okay, let me just start it up. Okay, now if everybody in the chat could just let me know if you can see the medical conditions and symptoms slide. You can see it? Okay.
Yeah. Do you want to go back that they see the prior slide, just have a glimpse of it?
Yeah, sure thing.
I think that's...
All right, yeah, take it away, Kaivan.
Yeah, so go back to, I'll go really fast so they can see it. Go back a couple of slides. Yeah, so this was when I talked about the cannabis and the origin, THC and CBD. The next slide, the discussion that I had about cannabinoids, the different 3 sources of cannabinoids, phytocannabinoids, synthetic cannabinoids, and endocannabinoids. And next slide was all the reasons for the new regulations, the principles, and different systems in place. Next slide was the differences between MMAR and MMPR. And now we are on the next slide. So under MMAR, there were two different categories of authorization to have access to medical cannabis. There are predefined conditions that physicians could authorize patients to have access to medical cannabis that you can see on the screen, as well as another category for compassionate end-of-life care, which required two physicians to collaborate to authorize medical cannabis for patients. Under MMPR, there is no limitations on the condition for which a healthcare practitioner can support or prescribe medical cannabis for the patient. Having said that, there have been guidance documents published by different groups such as Canadian Family Physicians, as well as licensing bodies that guide prescribers on how to assess, prescribe, and monitor patients when they prescribe medical cannabis to the patient. Next slide. And there were 2.3 million Canadians using cannabis, according to published data in 2011 by Health Canada. 17.7% of those, or 420,000 of cannabis users, reported using it for medical purposes. Or in other words, 1.6% of Canadian population aged 15 years and older. Obviously, these numbers do not in any way measure or reflect the enrollment in the MMAR program. Up to 2013, there were only 40,000 registered patients under that program. Prevalence of use for medical purposes was similar between male and female users. More than 21.8% of cannabis users aged 25 years and older reported using it for medical purposes. 49.7% of the users mainly use cannabis for chronic pain caused by conditions such as arthritis, back pain, and migraine. The remaining 50% use cannabis primarily for one of a variety of conditions that included insomnia, depression, and anxiety. Canada has one of the highest rates of cannabis use in the world. More than 40% of Canadians have used cannabis in their lifetime, and about 10% have used it in the past year. No other targeted drug is used by more than 1% of Canadians every year. Next slide. So what are licensed producers? Licensed producers are licensed and operate under the supervision of Health Canada and shall comply with local bylaws and regulations. Licensed producers are required to develop, validate, and implement standard quality methodologies and practices. LPs are required to follow good production practices, and all aspects of production, quality control, packaging, and distribution is monitored constantly. Everyone working for a licensed provider, licensed producer, should have RCMP security clearance. When MMPR regulations was introduced, dried cannabis was the only product that was authorized to be produced and distributed by licensed producers. Due to the recent Supreme Court ruling and amendment to MMPR regulations, we are now going to be allowed to produce and distribute oil or extracts on fresh cannabis buds or leaves. And all the operations by licensed producers are conducted only in indoor and secure environments. Next slide. By implementing highest quality process and procedures, licensed producers provide consistent, reliable medical cannabis varieties with laboratory controlled and tested, and quantified levels of THC and CBD. Products shall be free from contaminants such as mold, bacteria, heavy metals, and pesticides. Because medical cannabis dispensed by a licensed producer is considered a valid medical expense, it can also be claimed as a medical expense for tax purposes. So in other words, medical cannabis produced by the licensed producers is a cheaper, legal, and safer access to medical cannabis. It is interesting that there was a recent article published in JAMA and that looked at dispensaries in the United States, and it looked at California and Colorado, and what their goal was to review the accuracy of labeling on products being sold on dispensaries. And what they found was that out of 75 products that they reviewed from 47 different brands, only 17% were accurately labeled. 23% were under-labeled, and 60% were over-labeled with respect to THC content. Next slide. So the next question is, who may benefit from medical cannabis? Well, Canada has published a comprehensive information document for healthcare professionals. In this document, many of the symptoms and conditions that you see on this slide are reviewed in detail. Pain, nausea, vomiting, loss of appetite, anxiety and depression, and sleep disorders are main symptoms affecting many cancer patients, which may benefit from usage of medical cannabis when appropriate. You will see other conditions on this list. Probably you have heard about kids with seizure issues that have benefited from using medical cannabis. Or you're familiar with a recent study which was done by Dr. Fraser on using cannabinoids for the management of PTSD. And obviously you may have heard about usage of medical cannabis on MS patients and probably Crohn's disease. Next slide. So what is the evidence? These are two recent articles that were published 2 months ago in Journal of American Medical Association. And they were meta-analysis, and they looked at the trials and the outcome. And these are the exact statements from the article. Use of marijuana for chronic pain, neuropathic pain, and spasticity due to multiple sclerosis is supported by high-quality evidence. And the CFPC guidance document that was published last year by the College of Family Physicians of Canada also discussed the usage of medical cannabis for pain and anxiety. There are lower quality evidence suggesting that cannabinoids were associated with improvement in nausea and vomiting due to chemotherapy, weight gain in HIV infection, sleep disorders, and Tourette syndrome. They also noted that the cannabinoids were associated with an increased risk of short-term adverse effects. Next slide. Last year, in collaboration with Canadian Cancer Survivor Network, we launched a survey to ask the patients their experience with medical cannabis. These are some of the data that we found. 38.8% of the patients that responded to the survey said that they wanted to speak to their physician about medical cannabis. But 56.3% of these patients said that they did not speak to their physician in fear of unfavorable response. And 21.6% of the patients were not satisfied or were dissatisfied with the current management of their symptoms. Next slide. Other than unfavorable response to medical cannabis, response for not speaking to their physicians, there were other reasons that patients didn't speak to their physician. The other one was afraid. Patients were afraid of stigma. They didn't have enough information, and they were not comfortable with smoking. This is very important as well, that smoking is not the only means of using cannabis, and having the knowledge would help patients to break these barriers, and having reliable information for the patients is very, very important. We also asked the patients what sources did they use to receive information about medical cannabis. The majority of respondents on this survey said that they used internet or the web, and they spoke to their friends and family, which again points out the importance of using reliable information and access to reliable sources to gather the information regarding medical cannabis. And out of all the patients that we had on the survey, only 24.5% of patients discussed using medical cannabis with their physicians, and 16% of the patients were able to reduce other medications by using medical cannabis. Next slide. This is also an important data point. Almost 12% of physicians suggested that their patient use medical cannabis, but less than half of those gave their patients a prescription for it. So some of the patients went to the street to buy their medical cannabis because they didn't have any prescription for it. And 34% of the patients that responded to the survey said that they have used cannabis in the past, and 11.6% of the patients were currently using cannabis. The other important data in here is that out of that 11.6%, only a fraction were using licensed producers, so they were using cannabis from other sources. And as I explained, the processes and the quality of the product produced by licensed producers, it is going to give you the importance of how critical it is to have a reliable source for the medication, that you get the same quality product and consistency of the product when the patient is using it for medicinal purposes. Next slide. One of the other questions we asked our patients is that why did they use cannabis? What symptoms they wanted to treat? And this goes back to the prior slide that I explained to you about the symptoms that can be managed by using medical cannabis. So patients use it for pain, patients use it for lack of appetite, nausea, vomiting, and stress and anxiety and insomnia as main reasons for use of cannabis. And the cancer distribution between the respondents, we had the highest level was breast cancer, prostate cancer, and ovarian cancer in this survey. Next slide. I have two patient scenarios for you to give you a little bit perspective of who are the actual users and some aspects. Maria is a 74-year-old female. She never used cannabis until she turned 61. First used it to improve her appetite during chemotherapy for breast cancer. Cancer has now returned and metastasized to her spine, and conventional painkillers have not worked. So now she's using medical cannabis for her pain relief. Next slide is Marilyn. She's 68 years old. She has metastatic breast cancer. She's currently undergoing chemotherapy. She has very low energy, minimal appetite, and substantial pain. She has severe nausea and vomiting, which cannot be controlled with regular medications. And she's taking multiple medications for pain, and she's still suffering. and she is starting medical cannabis to manage those conditions. Next slide. So we looked at who are the candidates to use medical cannabis, some scenarios, but similar to any other medication, cannabis is not appropriate for everyone. There are conditions and patients that are not good candidates to use medical cannabis. Similar to any other medication, cannabis is not recommended for patients that are allergic to it. If patients have history of serious mental disorders, such as schizophrenia, psychosis, or bipolar disorders, they are not good candidates for medical cannabis. Because cannabis is metabolized by the liver and excreted through kidneys, if someone has severe liver or kidney malfunction, they're not excellent candidates for cannabis, or patients that have heart or lung diseases. If someone is pregnant or planning to get pregnant or nursing, they're not good candidates to use medical cannabis. And patients under the age of 18 are not generally recommended to use medical cannabis. Obviously, as I mentioned about the Dravet syndrome or seizures in kids, always the risk-benefit evaluation by the physician will determine whether the patient is eligible to use medical cannabis and what is the risk-benefit comparatively. Also, if men are wishing to start a family, we do not recommend them to use medical cannabis, and patients who have history of alcohol, drug abuse, or substance dependence are not the best candidates to use medical cannabis. The brain develops until the age of 25, and according to College of Family Physicians of Canada, the recommendation is that patients do not use medical cannabis until the age of 25 unless there are absolute indications to use. Next slide. What would be the side effects of medical cannabis? Generally, the 3Ds are the main side effects of medical cannabis, which is dizziness, drowsiness, and dry mouth. And the use of cannabis can reduce the ability to react and can cause a lower. And I will discuss about using cannabis and driving a little bit later during the presentation. The other common side effects that patients may observe is euphoria or high based on the strain or type of cannabis they are using, blurred vision, red eyes, and headache. And then they may notice the blood pressure falling if they change position, or what we call it as postural hypotension, in the beginning of therapy. And there are other side effects that patients may experience. There are no cannabinoid receptors in the brainstem, which controls vital functions such as respiration. Because of this, cannabis has not been associated with causing any death. In comparison, the number of fatal overdoses involving opioids have jumped up 24% between 2010 to 2013 to 577 patients in 2013. Next slide. How fast cannabis works? The absorption of cannabinoids in the body is dependent on the methods of administration. When cannabis is inhaled, cannabinoids are absorbed into the blood within minutes, and they transport it to the brain. Maximum cannabinoid concentration in the brain is achieved within 15 minutes, with correspondence with the peak of the psychological and physiological effects. Absorption is different by individuals and is based on various factors, including the heatings of cannabis, the number of inhalations, the waiting time between the two inhalations, the inhalation period, and lung capacity. When cannabis is taken orally, absorption absorption of cannabinoids in the blood is slow and more unpredictable. This results in effects being delayed 30 to 90 minutes, with the maximum effect being experienced 2 or 3 hours later. The effects last 4 to 8 hours. And this is very important when patients want to use and consume cannabis. Obviously, with this data, you can realize that using cannabis via an oral method is maybe more beneficial during the nighttime. The patient has a consistent levels of cannabinoids in their bloodstream to control their pains or help them with insomnia and give them a good night's rest compared to inhalation, which lasts much shorter. Next slide. And this was not in the original presentation that I had, but based on the call I had with one of our patients yesterday, I put it in to just emphasize the fact that cannabis or phytocannabinoids are produced as carboxylic acid, which means that they are inactive. In order for cannabinoids to become active, they need to be heated to use their carboxylic or CO2. And that's why it is important that the patient, prior to the usage, heats the cannabis they are using. So if they do not heat the cannabis, they are not going to get the effects that they are expecting. And that's why using the vaporizer or brewing the cannabis appropriately for the appropriate duration of time is very important to receive the maximum effects. Otherwise, the patients are not going to have the effects they're expecting. And if you use cannabis or use it, you will not experience any of the benefits that expected from THC or CBD that we expect receiving. Next slide. What is the dosage of cannabis? Yeah, approximately the dosage for cannabis ranges between 1 to 3 grams per day. The optimal dose should improve patient condition, for example, pain and function, while causing minimal euphoria or cognitive impairment. We always suggest to start from a very low dose and gradually increase the dosage until we get the relief from the symptoms or we experience any kind of side effects, similar to prescription cannabinoids or other medications that are being used. And I also put the recipe for preparing the tea here, which is derived from the Netherlands guidance document for the patients that they use half a gram of cannabis in half a liter of water, but it has to be brewed for 15 minutes, proper extraction and decarboxylation of cannabis. And that's also important as well. Obviously, smoking cannabis is harmful, and using more safer methods such as vaporization and using oral methods are much safer comparative to smoking cannabis. Next slide. So what is the abuse potential and dependence to cannabis? Although cannabis can be addictive, a smaller proportion of people who try cannabis ever become dependent on it than compared to other substances. When you look at this table, cannabis dependence potential is only 9% compared to alcohol with 15% and nicotine, which is 32%. That's another very important factor to consider here regarding the dependence. Next slide. So how can a patient access medical cannabis? So with MMPR regulations, the patient needs what is called a medical document, that is authorization by a physician to receive medical cannabis. They need to complete a registration form by a licensed producer, submit those to the licensed producer, and they can order their medication. So it is a very easy process comparative to the old MMAR regulation. Next slide. So how to communicate with your physician? Going back to the data that I shared with you, many of the patients are not comfortable speaking to their physician, so it is very important to have a better perspective on how to communicate to the physician. It's also good to note that cannabis is not appropriate for everyone, and it's not something that is suitable to be used by anybody. So it is at the end the judgment of the physician who's going to identify whether cannabis is appropriate for the patient or not. Also, do not expect that as soon as you ask your physician, they're going to give you a prescription for it. They need to try traditional medications if you have not tried them, and they need to do assessments and tests. In many cases, your physicians may not be comfortable or educated enough to prescribe medical cannabis. And in those cases, it may be beneficial if you ask them they are willing to refer you to another physician who is more specialized in prescribing cannabis. It's important to share the symptoms that are not being managed successfully with your current treatment protocol and how it impacts your quality of life. And make a list of what worked and what did not work for you. Next slide. And if you're going to see the other referring physician, always bring credible information with you. Any supporting material is going to help you and the physician to properly assess you. If you already use medical cannabis, let your doctor know about it. How long have you been using it? What is the dosage and frequency you're using it? And what's the route of administration? Are you using it orally? Are you inhaling it? And what experiences have you had? And if you have never used cannabis before, get informed. Speak to others who use it to manage their symptoms. Contact licensed producers. Ask questions. We have good resources for you to answer your questions and guide you through the process. And check reliable websites, such as Health Canada or CCSN website. Next slide. This is an example of the medical documents. I mentioned a couple of times during the presentation that a patient needs a medical document. In other words, the medical document is equivalent to a prescription. So it has a section which is the physician's information, has a section with the patient information, and it has a section for the medication. But in this case, it's cannabis. So the patient is going to identify the number of grams per day the patient is going to use, the duration for the prescription, which is maximum of 12 months, and the physician can put any duration that they deem appropriate for the duration of the prescription. And they may want to specify the THC or CBD concentration or the percentages for the patient, but these are not required as part of the Act, and they are testing that the information in this document is accurate. So the only difference is this attestment at the bottom of the medical document. The rest of it is very similar to the regular prescription. Next document. Sorry, next slide. So there are 3 different types of forms for registration. For the 95% of the patients are going to use just Form A, which is for applicants with a residence. So if you live in a house or a residence, you fill just Form A, which has your information, your address, what shipping address you want the licensed producer to send the product to you, and you sign the document. Form B is for people that are living in a shelter or a hotel, and Form C are the cases that the physician wants to receive the medication directly and then dispense it to the patient. So these are the 3 different forms available for registration. But most of the patients are going to use Form A for registration. Next slide. There are 3 main species of cannabis, and you may have heard of indica, sativa, and ruderalis. Ruderalis is the hemp, and indica and sativa are the species that are generally used for medicinal purposes. Indica is generally known for its calming benefits and commonly used to relieve inflammation, arthritis, and muscle tension, and helps promote a good night's sleep. Sativa is known for its stimulating properties and is known to generally benefit for daytime use. And it has been known to help with pain, nausea, and increasing appetite. And hybrids are the combination of these two different varieties. And most strains are hybrids of indica and sativa with one or the other dominant. Hybrids can yield a balancing combination of medical use and effects. Hybrid strains can potentially produce effects that are typically associated with either indica or sativa strains. Next slide. Relatively little is known about pharmacological actions of the various other components found within cannabis. And one of those examples are terpenoids. However, it is believed that some of these terpenes may have a broad spectrum of action, but this information comes from a few in vitro and in vivo studies, and no clinical trials exist to support these claims. But still, it is very important to understand the other components of cannabis, and that is the answer to many of your questions regarding different strains and why strains with similar levels of THC or CBD produce different characteristics. It is also proposed that cannabinoids and terpenoids may form a metabolic entourage effect that is responsible for the bioactivity of cannabis. And this article was published in the Journal of Pharmacology in 2011. Next slide. So how is the product shipped to the patient? The packaging cannot be more than 30 grams of dried cannabis in each dispensed container. It has to be a tamper-evident packaging and it has to be child-resistant. It has to be securely shipped to the patient directly from the licensed producers. It should be traceable during transport. And the patient cannot receive in one shipment 30 times their daily usage of prescribed medical cannabis, or 150 grams, whichever is the less. And the cannabis should be stored in the original packaging at room temperature while not being used. Next slide, please. So what is the proof of legal possession under MMPR? So if you have the cannabis, what do you need to have with you if someone asks you why you are using medical cannabis, whether you are a legal user of medical cannabis? The label that is issued by the product or the shipping invoice serves as proof of legal possession for clients. Now, the licensed producer also issues an identification card, which has the information of the patient, their physician, their authorized levels of medical cannabis that they can use, as well as the contact information for the licensed producers that law enforcement and police officers can contact and ask questions regarding the patient's authorization to have cannabis in their possession. So that's what the patient needs in regards to prove that they are legal users of medical cannabis. Next slide. The other question that we are generally being asked is, can I travel with medical cannabis? The answer to this question is that because this is a federal regulation within Canada, you may travel anywhere within the Canada without any problem, as long as you have your documents with you to prove that you are authorized users. Anywhere outside of the Canada, you have to do your own due diligence to make sure that you are okay to transport it. Generally, transporting it across the borders is not permitted. And for example, if you look at USA, the federal government considers cannabis illegal, and you cannot transport medical cannabis to U.S. The question that some patients would ask is that I do travel and I need my cannabis. How can I continue my therapy? And one of the options that some physicians have adapted is that they have a prescription for medical cannabis as well as a prescription for a synthetic cannabinoid, and that the patient can use synthetic cannabinoids while they are traveling, and then when they return, they can use the medical cannabis that they use regularly. Next slide. Cannabis and driving. The other questions that the patients ask generally is that if I use cannabis, can I operate machinery or can I drive? According to the Canadian CFTC guidance document, College of Family Physicians of Canada, patients using dried cannabis should be advised not to drive for at least 4 hours after inhalation, 6 hours after oral ingestion, or 8 hours after inhalation or oral ingestion if the patient experiences euphoria or the high. Next slide. Okay, I think we covered everything, and we are right on time.
Okay, thanks, Kaivan, for that presentation. I hope everybody that attended today learned something new. I know I did. And we're getting a couple of questions here. We have one from Deepak, who asks, the patient data using licensed producers for their needs are from 2014. What are the patient stats using licensed producers versus dispensaries for 2015? Is there any data for this year on that, or is it still only from 2014?
Yeah, there is no data that I am aware of.
Yeah, okay. That's what I figured. I know we did that study last year. So Deepak, we don't have any numbers for this year, so the 2014 data is the most recent. Joanna's asking, are we able to watch this recorded webinar again? Yes, as I mentioned earlier, Joanna, we will be uploading this webinar to YouTube tomorrow. So we will send out an email to everyone who attended the webinar with the link to that. And Deepak also asked if the slides will be made available. Yes, Deepak, they will be available as well. We'll send out a link to the slides tomorrow at some point. So it'll have the link to the slides as well as a link to the entire webinar recorded. So you can look for that tomorrow afternoon, probably at some point. Now it looks like, I think those are all the questions for now. So folks, if you do have any questions, you are able to ask those. There's a questions toolbar on the right-hand side of your screen. If you don't see it, there is a control panel at the top right of your screen. If you go there and you click the little orange arrow that's on it, you can expand the toolbar and you should be able to see the place where you can ask questions. So that's where you will ask questions if you have any. Just waiting on a few more today. Just so everyone knows, CCSN is hosting more webinars in the fall. We're going to hold a couple in September, a couple each month until the end of the year, basically. So as soon as we have information on that, we'll be sending that out. So make sure, if you're not already subscribed to our e-letter, you can do that on the front page of our website, and we will send out information on upcoming webinars just as soon as we have that information available. Still waiting on questions here. Don't think we have any more at this point. One more time, yes, we will be sending out links to both YouTube and the slideshow. So we'll actually put them up on our website later today, likely, but then we will email everyone too, so you have links to those. Okay, well, if there's no other questions, I'll give it another minute here, but if there's no other questions, I will flip it back over to you, Kaivan, just for a minute, and you can, if you got anything more you want to say, you can. If not, then we'll just sign off in the next minute or so here, I guess.
Thanks again, Matt, for the opportunity, and we are very delighted to have this opportunity to present this information. And if anybody has any questions, you can see the contact information on the screen. You can call our info@canntrust.ca. You can send your questions to me directly, or call customer service to answer any of your questions. And we are looking forward to more opportunities in the future.
Okay, awesome. Yeah, like Kaivan said, there's the contact info on the screen there, and you can also contact us if you have any questions. I mean, it's probably better to contact Kaivan or CannTrust themselves if you have any questions regarding medical cannabis or anything that was covered today. But you can also contact us if you have any other questions, info@survivornet.ca. And now there's still no other questions, so at this point, I guess we'll wrap things up, and we'll sign off for now, and we'll see everybody at our next webinar. Thanks for watching, everyone, and we'll see you later.